Hi, everyone. My name is Dr. Effie Habsha, and I'm a prosthodontist practicing in Toronto, Canada. Today, I'd like to share my expert tip with you on implant maintenance. Now, my practice is limited to prosthodontics and implant dentistry, so many of my patients have implant-based restorations. Research has shown that maintaining excellent oral hygiene around dental implants is critical for implant survival. So, with that in mind, it is essential for both the dental professional as well as the patient to properly care for their implant based restorations. Now, it's important to recognize that plaque behaves very differently around dental implants than around natural teeth. In fact, plaque grows more slowly around implants compared to natural teeth. However, subgingival plaque around implants contains more gram-negative anaerobic bacteria than around natural teeth, so it's much more virulent. So effective mechanical removal of plaque with the use of an oscillating rotating toothbrush, as well as effective chemical removal of plaque, is critical to minimize the risk of peri-implant mucositis, which, if left untreated, will over time result in peri-implantitis. So with that in mind, the use of a toothpaste with proven antibacterial efficacy is beneficial in combating peri-implant disease. Now, when it comes to fluorides in toothpaste, there is sodium fluoride that we're all accustomed to, and stannous fluoride. Now, both have anti-cariogenic properties, but stannous fluoride has long been shown to have both bacteriostatic as well as bactericidal properties. As such, stannous fluoride inhibits plaque growth, reduces the metabolic production of toxins, and directly suppresses pathogenic virulence. The latest meta-analysis by Biesbrock et al., published in 2019, showed that the Crest gluconate chelated formulation of stannous fluoride resulted in 51% reduction in bleeding compared to regular sodium fluoride and sodium monofluorophosphate toothpaste. Other studies also showed that it penetrated up to 4 millimeters below the gum lines and remained there for up to 12 hours. So with this knowledge in mind, I always personally recommend stannous fluoride containing toothpaste to my patients, like Crest Gum Detoxify, coupled with an oscillating rotating toothbrush in order to achieve ideal oral health and implant maintenance. So applying this expert tip to your practice will ensure that your patients protect their investments. I hope you enjoyed my expert tip.